Hello, everyone. We will be with you shortly. The webinar will begin at 7 o'clock. Thank you. Welcome, everybody. Thank you for joining us this evening. My name is Matt McCloskey. I am the founder and executive director of the Take a Breather Foundation. And we thought with all the discussion and talk involving COVID-19 and going back to school, we thought it was important to get the most up-to-date information out there to parents and students living with CF so that they had this information to make an informed decision regarding their personal situation. So tonight we are honored to have Dr. Aaron Chidekel. He is the CF Center Director and Chief Division of Pediatric Pulmonology at the DuPont Hospital for Children. And we also have with us Lauren Kern. She is the CF social worker at the DuPont Hospital for Children. So we're glad to have both of them with us tonight to join us in our discussion. I just have a few things that I need to some announcements that I need to make just before we get started here. They're just the general, letting you know that this webinar is being pre-recorded and it will appear on our website and our social media. And the content of this webinar is for general information purposes only and should not be used for diagnosis or treatment. Please always consult with your personal CF care team before making any changes or, any health management, anything to your health management or care plan. I also would like to thank our sponsors who make this webinar possible, and they are Gilead Sciences, Mylan, Alliance RX, Walgreens Prime, and Foundation Care. So thank you very much for that. The chat feature is open. You'll see it at the bottom of your screen if you need to get in touch with our moderators. We also ask you to use the Q&A tab at the bottom of the screen to ask any questions that we will open up the Q&A session after Dr. Chidekel and Lauren after our discussion. That's about it for me. I will now turn it over to our featured speakers, and we'll go from there. Thank you.
Thank you, Matt. Good evening, everybody. As Matt mentioned, my name is Dr. Aaron Chidekel, and I'm the CF Center Director at AI DuPont Hospital for Children. For those of you who don't know me, I'm a pediatric pulmonologist I've been at DuPont since 1996, and so I've really been a part of this community for my entire career, working at Nemours and really being a part of the Delaware Valley CF community, as well as the national CF community. And it's been an honor for me to participate in that for this ever expanding period of time. This is certainly an amazing time in CF. There are some stresses that we'll talk about tonight, but overall, it's really an amazing time for this community. The other thing that's really wonderful about the community here in the Delaware Valley is there are wonderful resources. There are lots of CF centers, obviously, and care teams that are committed to your health if you're a person living with CF, your child's health if you're a parent, and really the strength of the CF community here is going to get us through this no matter what. With that in mind, this is something, no matter who we are or where we live, that we're experiencing together. All of us are confronting the challenges of the new coronavirus or COVID-19 or whatever terminology we want to use. This is a new thing, and so my family is no different. And so just to, again, those of you who know me know that I sort of wear my heart on my sleeves, and I'm sharing things with my patients, my team, and the families that we work with all the time. So my 3 children are 21, 23, and 25, roughly. And 2 of them are getting ready to go off to college in some way, shape, or form. And 1 of them is living with Crohn's disease. And so many of the things that are top of the mind for you all have been items of discussion in my family as well. My dad just turned 95 this past weekend, and so we have that joy, but that stress right now as well. The other thing that I think, again, those of you who know me know that, and this is true of anybody, life experiences influence our personal decision-making, and those life experiences influence our risk tolerances as well. And the discussion tonight is about risk tolerance. It's about knowns and unknowns, and it's about us as individuals, as teams, as families, as a community, how we address those things together so that we can move forward in what we think is the best way possible. I'm going to pause for a moment. I'm going to ask Lauren if she would like to do a brief introduction of herself so that you know who your esteemed panelists are.
Thank you. Hi, my name is Lauren Kern, and I am the Cystic Fibrosis Social Worker at AI DuPont Hospital for Children. I've been with our team at Nemours for about a year with the CF Center, and with Nemours total for about 4 years. And I've been thrilled with the time that I've been able to spend with the pulmonology team and everything that I've learned from the CF community, from my team, and from our patients. It's been a blessing for me. I'm happy to be here. Thank you for having us. I'm very excited. I hope that this is meaningful for everybody and that you get some value out of it at the end. And I know that I can speak for all the teams that we are here for you. We're here for our patients, and we'll support in any way we can. Thank you.
So while we talk tonight, one analogy that I hope you'll find useful, it's something that I think about from time to time when we're evaluating, well, it could be a treatment for a patient, or it can be a community-based risk like COVID-19. And that analogy is akin to a seesaw, if you will. On one side of the bar, you have risks. On one side of the bar, you have benefits. In the context of the discussion tonight, clearly there are benefits of attending school, moving around in the community, just like there are potential benefits of any new therapy. And there are also risks that are associated with these sorts of steps as well. And so there are risks and benefits, and we balance those things against unknowns. And the way that I think about the unknowns is sort of the height of the seesaw above the ground. And the more that is unknown, the taller the seesaw is above the ground. And I guess if you're a daredevil, then height is a good thing. But when you're thinking about risks and unknowns, in some ways, height is a bad thing. As we learn more about something, those unknowns decrease and the risk-benefit bar comes closer to the ground. The other thing that I want to stress is that information about COVID-19 is really progressing at a measured pace. I know it seems different every day. It seems like there's something changing. There's 7,000 messages. There's a very high noise to signal ratio, if you'll allow me that analogy as well. But really, when we think about a viral infection, a viral pandemic, time is measured in weeks and sometimes even months rather than minutes or even seconds as it would be in a different kind of disaster. And so often, although the news seems overwhelming, although it does seem like the numbers are changing every day, I think it's also fair to say that we can take a breath, not to use a bad pun, Matt, but we can sort of take a breath and assess what's known, what's unknown, and then move forward with our discussions about decision-making and things that, that we're comfortable with. Lauren, anything you want to add to those? I hope that they were helpful analogies.
Yes, I want to say first, I couldn't agree more with your analogy and the way you present that and the risks and benefits that we all take, especially our CF community, every day with every decision, starting a new treatment, going to school, playing a sport, all across the board. And this is, you know, a new situation that everybody's been presented with. And one thing I'd like to stress, and something I stress in a lot of situations, is that every solution or accommodation or choice that you make for your family is going to be unique and individualized to your family and to your needs. So it'll be important to work with your family to make the best choice for you with your CF center moving forward.
Thank you for that. And I'll also just reiterate that in this situations, there are decisions that are most comfortable for us as individuals and our families. And there really are no wrong decisions. And so this is really something that I think we want to stress and is very central, I think, to the collaborative, the family-focused, and really the supportive nature of CF care. And I know that I speak for my teammates at all of the centers in the Delaware Valley that we very much share that philosophy. Now, I'm a pediatric pulmonologist. I'm a pediatrician. I do not treat adults over the age of 21. And so some of the information that I'm going to share is going to be sort of filtered through that lens tonight. If there are questions about adult-related issues, I will do my best. But in the with the goal of being respectful and not creating confusion, if I do punt, please understand. So I think there's some things that are pretty clearly understood about COVID-19 and risks related to severe disease and the worst possible outcome, namely death. And those risks have really been steady, and they've been consistent since the early phases of the pandemic. And so I'm going to list a couple of things for you now that I think I'm comfortable saying, because I think it's knowledge that we can trust, and I think it's knowledge that has been consistent no matter where the pandemic has unfolded. And so I think when we think about risk for severe COVID respiratory disease, the things that really have been consistent is a very strong age relationship, whereby the older you are, the higher your risk of doing poorly with this new viral infection. And it really seems that there's an important inflection point, meaning a place where the risk increases significantly. And that inflection point is in the decade of life of the 60s. And so I mentioned my dad, who's 95. He would be at extraordinarily high risk should he become infected with the new coronavirus. Whereas somebody who is much younger than him, their risk based on the variable of age would be much lower. Other things that have consistently been shown to impact outcome and severity of COVID-19 respiratory disease include obesity, hypertension or high blood pressure, and the type of diabetes that goes along with obesity, so type 2 diabetes. And again, that may not be the correct term for it, I apologize. But those really have been very consistently associated with severe or poor outcomes with the new coronavirus. With respect to children, the data are much more reassuring. Not perfect, mind you, but much more reassuring, so that it really does seem that the younger you are, the younger we are, the less likely you are to have severe COVID-19 respiratory disease or a terrible outcome from a coronavirus infection. And so again, if we look nationwide in the United States, there really have been very few fatalities reported related to the new coronavirus infection. Some children have become ill, some children have become severely ill, but those numbers are much lower, and thankfully so, than we initially feared back in the cold, dark days of February and March. Now, this is a CF-related discussion, and thanks to the CF Foundation, which again is an organization that none of us can sing high enough praises of, we have excellent and up-to-date information about the status of COVID-19 in the US CF registry. My understanding is that the vast majority of people with CF in the US are in the registry, and therefore I think these data will reliably capture what is going on in the US CF community. And every Thursday, Paula Lomas from the foundation has been sending me an email. I know she sends other people an email too, but it makes me feel special to get it. And so this morning at 6 a.m., I received my weekly Thursday email from Paula. And here are the numbers based on what has been reported to the US CF registry. So far, there have been close to 3,000 tests done looking for COVID-19, 2848 for those of you who are numbers people. and those tests have been done in 2,323 patients. So some people have been tested for COVID-19 more than once. And so that's where those numbers are a little bit different. Of those numbers, there have been 148 positive cases in the US, and of those, there have been 47 pediatric cases. So 47 out of 148 out of roughly 3,000 tests. And so roughly 5% of the tests that are performed are positive, and a third of the tests, or maybe a little bit less than a third of the tests, are pediatric cases. Of those cases, 9 pediatric patients have required hospitalization. And so you can look at that however you like, but those are the numbers. And of the CF patients hospitalized, there were 39 total. So out of that 148 positive cases, there were 39 patients hospitalized, and 9 of those patients, or 9 of those people, were children with CF. Among those cases in the registry, 18 were of advanced lung disease. So usually advanced lung disease means your FEV1 is in the 30 to 40% range. And in that group of 18, there's 1 death that has been reported. There have been 6 cases in patients after lung transplantation, and in patients who have received lung transplantation, 2 deaths. And so if we total that up in the US, reported to the registry, as of this morning, there have been 3 deaths of people with CF living, people living with CF in the registry in the US. So again, how you look at those numbers is going to be based on your individual worldview. But to me, those numbers are not that high. 1 is too many. I don't want to be misunderstood. But if we think about how we're trying to evaluate risks and benefits, those are the numbers that are presented in the US registry. I was able to find a study from Spain. Earlier in the spring, there was a terrible coronavirus situation in Spain. And this was a paper that was published in a journal called Respiratory Medicine. So it's a peer-reviewed medical journal. I think it's a pretty reliable source, or I should say it is a reliable source. And in Spain, COVID-19 was diagnosed in 8 CF patients, 1 of whom had received a lung transplant. 4 of those patients were female, 4 were male, and the median age in the Spanish paper was 32.5 years. The range was 7 to 45, but only 2 of the patients were less than 18 years of age. So again, 2 children in Spain diagnosed with COVID-19. I do not know the denominator here. I don't know how many patients with CF there are in Spain, but according to the registry, there were 2,500 roughly patients that are reported in the paper. So roughly 2 or 8 patients out of 2,500, 2 of whom were under the age of 18. Now, I work at Nemours, as I've shared with you, and Nemours has clinics and hospitals in Florida. Between the Nemours system, we follow roughly 400 children with CF from the age of 0 to 21 years. And my colleagues in Florida and I, we talk. We're our own little community as well. And we have not had any patients at our institution hospitalized with COVID-19, and the experience in Florida is the same. And right now, Florida is having a terrible outbreak that we're hearing about on the news. But despite that, the number of cases of COVID-19 in the CF patients that are followed by Nemours there is probably zero, but I don't want to say that with certainty. It's very, very low. And similarly, our experience here at our children's hospital, DuPont, there have been very few children hospitalized with COVID-19 respiratory disease, and the same is true at the Nemours Children's Hospital in Orlando. So that's sort of the situation on the ground as best as I can report it to you with respect to COVID-19 in CF. Locally, I guess, Florida's maybe regionally, nationally, and from sunny Spain as well. Now, when I think about COVID-19 or coronavirus respiratory disease as a pulmonologist, I also think about the other vulnerable groups of patients who we see. And other groups of patients that we see include those with asthma, those with sickle cell disease, and those with various forms of chronic respiratory failure. And so with that in mind, I can also tell you that we've thankfully had very few of our children with other kinds of respiratory diseases presenting with COVID-19 respiratory disease. And in fact, there was recently some data published that suggest that COVID-19 is not a major trigger of pediatric asthma. And so I think that with respect to COVID-19 respiratory disease, that's kind of where things stand. The inflammatory condition, to be honest with you, is a little bit out of my area of expertise, but it's also something that has been uncommon, and I don't think it has been, to the best of my knowledge, increasing as cases have gone up around the United States. And so I think that's probably the most that I'm comfortable saying about the MIS-C or the inflammatory disorder that may be associated with COVID-19. I can share with you that we've had a few cases of that at our hospital. Not all of those cases were confirmed to have coronavirus previously. So there's some puzzle there as well. Now, I think I'm gonna shift gears over now to sort of how we move forward in the face of this viral challenge. And then I think we'll switch to a discussion about school. We'll bring Lauren back in as well. And then I see the Q&A is building up as well. So I also certainly want to remain open and save enough time so that we can have a little bit more of a virtual discussion. So to bridge to that, I mean, what is giving me hope now, in addition to the reassuring pediatric data that I just shared with you, is that the same technology and the same drive that has given us as a CF community Trikafta, Symdeko, and Kalydeco is working on a coronavirus vaccine. And as a community, the CF community knows the power of scientific inquiry and the power of clinical trials and the importance of doing those in the right way. And when done in the right way, boy, can it be impactful. And so there are vaccine trials that are moving forward quickly. The FDA is collaborating with the vaccine manufacturers and the scientists who are studying the vaccines to bring those to the bedside as quickly as possible. I'm aware of one vaccine trial that's already in phase 3, which is really quite remarkable when you think about the pace that this is moving at. And so that is giving me hope, and it is something that I'm watching very, very closely, both for effectiveness or efficacy, and of course, for safety. The other thing that's moving forward relatively quickly is antibody therapy, whether that be with plasma or whether that be with monoclonal antibody therapy. Those strategies are moving ahead quickly as well. And so hopefully that will be something that will be available to the community as a whole very, very quickly. I do want to say a word about flu vaccine. It's going to be more important than ever this year to get a flu vaccine, and there should be plenty of vaccine available. So I'm going to read something to you now that I took from one of the websites. And basically what it says is that vaccine manufacturers have projected that they will supply between 194 million and 198 million doses of influenza vaccine for the 2020-2021 season. This is a 20 million dose increase compared to the record 175 million doses distributed for the 2019-2020 flu season. So that's my plug for flu vaccine. Now let's talk about school. And this has been something that has received a lot of attention in the media. The American Academy of Pediatrics is an organization that I've been a member of since 1993, or maybe 1990 actually. And it's a very ethical and conservative organization. And it's like the CF Foundation. It wants what is best for its community. And it came out with a statement that I think was aspirational in some ways, that was encouraging schools and encouraging the situation to be created so that children could get back to school for some, at least some, in-person learning. I'm going to come back to my seesaw for a moment because obviously there are benefits to going to school. And in the situation of a pandemic, whether it be an H1N1 influenza pandemic or a new coronavirus pandemic, there are clearly risks to attending school as well. And here the base of the seesaw, if you will, is precautions or things that can mitigate risk. And that's something that we can talk about openly. But my understanding, and boy, this is changing quickly, is that school districts are creating plans that offer flexibility and choice so that families can make individual decisions that fit their individual needs and their individual risk tolerances. I'll also remind everybody that one of the statements that was in the AAP position statement had to do with mitigating risk as opposed to preventing all infections, because sadly, I think that's an impossibility. I think that it is going to be an issue related to mitigating risk rather than preventing infection. And then it's up to us as individuals, as families, as care teams, as care units, to try and understand or try to decide for us if the risks have been mitigated to the level with which we are comfortable. And if that's something that we are not comfortable with, then the district and the CF team is there to help with flexibility, choice, and promoting success so that children can learn and grow and be healthy in all of the other ways that school and social interaction is important. I'm definitely going to pause there. Lauren, is there anything that you would like to add to what I just said? And then we'll take it from there. Okay, it's hard to tell, but Lauren seems to be frozen. And so,
Yeah, it looks like she may have been frozen up.
So Matt, why don't we start some Q&A and
Sure.
hope that we get Lauren back.
Sounds good. I just want to, we'll start the Q&A here. I just want to let people know that Dr. Chidekel and Lauren can address your personal or individual cases. So please phrase your questions so they are applicable to the CF community as a whole. All personal and situational questions should be addressed by your CF care team. So with that said, I will just start. We had some questions that were sent in to us prior to this webinar. So I will start with those. And I think the first one here, you did answer most of the question here. Are there many people with CF and low lung function who have had COVID-19? How did they handle the virus? And did they, did they suffer further lung damage? Those who survived, did they return to their previous lung function? Which I think you answered most of that.
Yeah, I guess I'll just interject, and I guess I'll say that, boy, are we dealing with low numbers, and that makes it difficult to draw conclusions. I think influenza is a useful analogy, and one of the reasons why it's so important for anybody with any kind of chronic lung disease to get influenza vaccine is because that's an example of a viral infection that can really have severe consequences in people with underlying lung disease. Now, whether COVID-19 or not is identical or perfectly analogous to that is really hard to say right now because we don't have enough information. But the numbers that I read to you before with respect to a low number of fatalities, both in the US and in Spain, and a low overall number of cases, that can be construed as reassuring, or it can be construed as the CF community is really fabulous. And we know this, the CF community is really fabulous at social distancing. And we do not have a good way of distinguishing between that. All we have is the global case count and the data that I shared with you earlier. So there are some limitations there.
Okay, great. The next question was, I'm hearing so many different views on using hydrochloroquine, zinc, and azithromycin as a preventative or an antidotal medication combo against COVID-19, yet so many are against even prescribing it. What are your views on its use? If our CF teenager contracts the virus, can we demand the combo of medicines given it is not being used to treat it?
So this is an area, boy, had things got murky very, very quickly. So my understanding is that hydroxychloroquine and azithromycin are not effective treatments for COVID-19 respiratory disease. I would be glad to be corrected by your personal physician or a physician with more experience than me, but that's my understanding of the current literature. And zinc, I have no knowledge of one way or the other. Treatment protocols in intensive care units and hospitals around the world have really been evolving and have been improving since the start of the pandemic. And so my sense and my answer is that any of the hospitals in the Delaware Valley where there is a CF center is going to provide the best care in the unfortunate circumstance that a severe case of COVID-19 respiratory disease, and the best up-to-date care in the event that a case of severe COVID respiratory disease in a person with CF or anybody comes to their doorstep.
Okay. The next question is, and I think you've answered this, what is the latest update on children transmitting and catching COVID-19? I know there's a lot of discussion in the news about this as well.
Yeah, I can add maybe a little bit more detail about that. It seems that children under the age of 10 are less efficient at transmitting COVID-19 to those around them than children older than the age of 10. Obviously, there's probably a gray zone in between the areas of 9 and 13, so take that for what it's worth. But if we think about the context of school, for example, it really seems that young children are less able to transmit COVID-19 to adults around them than they are able to transmit other common respiratory viruses such as influenza and respiratory syncytial virus. And so that seems to be something that is a little bit different about children in this pandemic setting. Older children seem to be very much like adults in their ability to transmit the disease. But again, I'll remind and reiterate the fact that younger people, thankfully, seem to be handling the virus and becoming less sick, much more so than older people. And so while it seems like teens and adolescents can spread the virus better than younger children, it still seems that the younger you are, the much, much less likely it is for you to develop severe COVID respiratory disease. And that gets to the issue of face coverings. I wear this around my neck now. I prefer the term face covering to the term mask because I think about them a little bit differently. When I'm working around patients, I have my loop mask, and when I'm doing procedures that are even more intensive than that, I have my N95 mask. The general public really needs to use face coverings, and face coverings can look all different ways, whether it's a ski gaiter or a buff, whether it's a bandana, or whether it's a cloth mask that a very nice family and consumer science teacher made for me from my kid's former middle school. Whether you have access to loop masks like this, or even when you want or have access to N95s. The general public wearing a mask basically is to protect those around you rather than to protect yourself. And so masks, face shields, face coverings, really the role there is to reduce the number of viral particles that come out when we are speaking, when we're coughing, when we're sneezing, when we're going about our businesses. The American Academy of Pediatrics feels that younger children should wear face coverings if the benefits seem to outweigh the risks. To be honest with you, I don't exactly know what that means, but I guess I kind of know when I see it. The reason that we wear loop masks in the clinical environment is because these loop masks do have some filtering capacity for large droplet particles. Now, it's thought that the main transmission route for COVID-19 is through large droplet particles that come out when we cough, when we speak, when we sneeze. And these face coverings block them on the way out. Loop masks block them on the way in and on the way out. A face shield would block things on the way out, but there's plenty of room for the particles on the way in. And the N95 is really the most meticulous or most the most careful protection that is used when intensive care procedures are being performed, and it's really probably not otherwise necessary for general use. If you're comfortable and you have it, you might need to take a break if you're wearing an N95 for a long period of time, but that's going to be to your comfort and your ability to wear it. There's nothing dangerous about wearing a loop mask for a long period of time. It may get a little bit hot and stuffy. It's not easy to exercise, and I don't recommend exercising with a loop mask. And same for a face covering. It's something that can be worn for long periods of time. It may be a little bit uncomfortable exercising in them. And if somebody does have reduced reserve or decreased lung function, that may be something that gets to be uncomfortable when worn for a prolonged period. But I don't think there's any danger to a person wearing a face covering or a loop mask for a prolonged period of time if that's what they choose. Okay, Matt.
Okay,
Sorry
great.
for that. Sorry for that.
No, it's great. Great, great information. And that, again, you kind of answered this, but I want to ask it. Is it safe for children of people with CF and low lung function to go back to school? What are your feelings about that?
Yeah, boy, that's a tough one. And so this is where individual families have to look at their situations and look at that risk and benefit balance and make a choice that they're most comfortable and most confident making. And so when I'm talking with patients and families who have elderly relatives living with them, who are living with people who are immunocompromised for whatever reason, who are living with people with serious underlying conditions, the decision-making may need to be dominated by the needs of the person who is most vulnerable. And boy, is that totally ethical and okay. And that's something that is really out there for discussion, and it's not something that we have perfect or even a lot of data to use to guide you. And so I approach those situations individually and with a great deal of caution.
Okay, great. Again, you answered this question. Are there steps that should or could be taken to prevent transmission? I think you went over all that with the...
So I went over some of that. And so if we think about sort of the bottom tier of the school seesaw, if you will, being precautions that the school can take, there are plenty of precautions that the school can take around social distancing, cohorting, and limiting admixture, if you will. And so what do we mean by that? Some schools may need to limit class size because the classrooms aren't big enough to maintain 6-foot distance. Some schools may need to cohort into groups so that groups of students stay together, and if one person or one student gets sick, then at least they know which cohort they need to track more closely. And then finally, preventing admixture in a high school environment, boy, that might be a challenge. But coming together in the corridors, coming together in school buses, dealing with transportation issues, those are all topics that need to be assessed at the individual school district level before and during the decision-making process. And then the final area with respect to schools is hand hygiene stations. And again, reminding students about the importance of hand hygiene as it goes throughout the day.
Okay, great. Lauren, this may be a question for you. What are a few things that you might suggest to safeguard and improve the mental health of our children if they are schooled at home while their peers are attending school in person?
I think that's a really great question, and a topic that I know was even bigger when the quarantine first started and families were at home, and children definitely went through some withdrawal from friends because kids are very social. Teenagers are very social. That's so normal for them. So I think some great strategies are going to be things that you may already practice with your children, you may already do, but molding it to fit a new situation. So when you have some kids that are going back to school and some kids that are staying home, I would suggest utilizing the technology that you have, Zoom meetings and Zoom birthday parties and social distance, drive-bys in the cars have become so popular and so valuable to people that the more you can utilize that to help keep social interactions up at a safe level, so that way kids are still seeing each other face to face, I think is going to be really beneficial. Having open conversations that are age appropriate with kids on their level about why the decisions are made for you not to go to school or for you to go to school, why some kids go and some kids don't, are great. Your care teams can help you with that. And there's a lot of really good information out there about age-appropriate ways to talk to kids about the virus and the effects of it and things that are going on right now. And I would encourage people to reach out to their local hospitals, their healthcare systems, because that's where a lot of the good information starts too.
Great.
Yeah, I would add to that, that particularly during the warm weather, socially distant outdoor activities are really very, very, very unlikely to be risky.
Absolutely.
And so I think that getting outdoors is so important for mental health. It's so important for sleep, but it also provides the opportunity for social interaction among children and adults even, as long as the concepts of social distancing are maintained and everybody is, being respectful of the guidelines with respect to maintaining safe distance and interacting in a safe way.
Mm-hmm. There's so many great ways and great games that you can do socially distanced through using technology to help kids stay engaged with each other. I've been so impressed by all the ideas that people have brought to me and things that people have talked about in clinic on how they've managed that with their children.
Great, thank you. Lauren, I think, again, here's another one for you. How can I optimize the use of a 504 form this year? I don't even know what a 504 form is, so maybe you could explain what that is too.
Yeah, absolutely. And that,
Right.
again, that's a great question. So a 504 plan at school is an individualized plan that addresses each student who has one, their medical conditions and what accommodations that they need to do their best and to be on a level playing field with all of their students. They come in really handy for our kids who need treatments during the day, who may miss school for appointments, who may need extra support in different areas. And utilizing those are going to be different if you're working at home or your child's at home, but I think they're still going to be very valuable. One way that I can think of that maintaining a 504 plan is going to be valuable is that any accommodation, or I should say most accommodations that are in your 504 plan, can really be modified and used virtually too. For instance, extra time on tests or extra time to make up projects or individual time with the teacher can all be done virtually through Zoom. Communication is going to be key, keeping in constant communication with your school social worker or your school psychologist, your school counselor, or the 504 coordinator, whoever that person is in charge in your school system or your individual school. That's going to be really valuable, is making sure communication is good with that person. I would also want to encourage our incoming kindergartners who may not have a 504 plan to still pursue one. Even if it doesn't seem like you think you need it at this point, if your child's at home, I think it's still important to do those, and any 504 meetings that are needed can be done virtually.
Okay, great. Here's a question. I think here in Pennsylvania, Governor Wolf answered this for us today. And in Delaware, I think your governor answered this the other day. If I send my child with CF to school, do you think it is okay for them to play fall sports? I think Governor Wolf came out today and said that he wants all Pennsylvania fall sports canceled. Correct me if I'm wrong. And the governor of Delaware has shifted the fall into fall sports after winter sports. But I'll let you go ahead and answer.
Yeah, thank you. I'm not, again, that's not something that I'm aware of. But this year, some compromises may need to be made. And I think the professional sports, baseball is perhaps an interesting notion where there have been outbreaks on teams. And I think that football is very much up in the air as well. Now, again, we just mentioned, Lauren and I, that outdoor activities can be done safely and in a socially distant fashion. And the other thing that we stress in our clinic, I know it's not the same as high school football or lacrosse or soccer, but stressing the importance of lifelong physical activity as something that is really to be promoted for mental health, physical health, for lung health. And so even if the sports are canceled or postponed, maintaining fitness and maintaining good, healthy activity levels is really something that's so important, and will also help overcome the disappointment perhaps somehow.
Okay. Yeah, we're coming up on the 8 o'clock hour, so I'll just ask a few more questions here. One of the questions from Heather is concern about wearing a mask for a 5-year-old for 6 hours. Is that any way potentially harmful for a CF patient?
Right. So, I mean, again, the American Academy of Pediatrics, I think, sort of addressed this in a nuanced way when they said that young children should wear masks when the benefits, or face coverings when the benefits clearly outweigh the risks. In a child who is typically developing and who is not severely affected by CF lung disease, I really do not see a danger in wearing a face covering from a respiratory standpoint. What I'm talking about with some of my asthmatics is having a few different things with them in the school if they need to switch from a face covering that's like this to a neck gaiter to a face shield for part of the day. Again, I understand the question is about a 5-year-old, and I think some schools are likely to not mandate mask wearing or face coverings for children of that age anyway. But I really don't think that there would be a risk related to breathing to wear a face covering for that period of time.
Okay. Another one here from Heather. The number of 0 from Delaware to Florida is impressive. Do you think that is due to us parents keeping our kids in the bubble as much as we can, or is it something to do with the treatment they get on a daily basis, and that may prevent them from being affected?
Absolutely. I think that's a very fair question. So the fairest answer to that question is we probably don't know. But I brought up asthma and I brought up sickle cell disease. I brought up Spain. I brought up other communities because in other communities, people live differently, sometimes by choice, and sometimes they're forced to live differently. And so many of the health disparities we hear about in different communities would include children with asthma who live in the inner city, for example, children with sickle cell disease who live in the inner city, for example, who live in situations that may be very different from, my suburban life. And those children, again, have not been severely affected or frequently affected by the new coronavirus. And can we extrapolate that to CF? Maybe we can, maybe we cannot. But boy, is the CF community adept and outstanding at keeping each other, keeping ourselves, meaning you guys, safe through social distancing. It's really something that the foundation has promoted very successfully, and that may very well influence the numbers that we're seeing. There's really no way to answer that question without a quote unquote randomized study where some families did and some families didn't. But some of the other examples that hopefully those are instructive or food for thought for you.
Okay. Do you feel 3 feet away with masks is enough feet in a classroom?
So I don't mean this in a facetious way, but some people are saying that 3 feet is the new 6 feet as long as you have a mask. What we're doing in the hospital is working very hard to maintain distances of 6 feet. And so, again, the answer to your question is we don't know. It's highly likely that 6 feet is better than 3 feet, but everybody wearing a mask is better than nobody wearing a mask, and 3 feet is better than 1 feet. And so, again, don't take that answer the wrong way. But when we talk about risk reduction, 6 feet is better than 3 feet, but 3 feet is better than nothing. And so if you're sitting on a school bus and it's 1 to a row instead of people next to each other, that's obviously one way of trying to mitigate the risk of personal proximity.
Okay. All right. It's after 8, so I apologize that we didn't get to everybody's questions. We just ran out of time, but I would like to take this opportunity to thank Dr. Chidekel and Lauren for being with us tonight. I don't know if you guys want to say any last minute words of advice before we close it out for the evening.
Yeah, I would just interject. I mean, if there's a few main things that we haven't touched on in the questions, I can go for another 5-10 minutes, whatever people are comfortable doing. That may not be the current protocol, but thank you for listening to me. I hope I haven't created more confusion. I'm going to turn it back over to Matt and Lauren, and if there are more questions, Matt, just have at me. No big deal.
Okay. Lauren, can you see the questions?
I might be able to see the
I
question.
mean, are there any in there that you feel are important that?
Let me see if I can pull them up. I'm happy to take a look at them.
Yeah. What level, here's one, what level of risk would you consider outdoor play, such as biking, swimming, or kicking a soccer ball? I think you did answer,
Yeah, my understanding is that the risk of outdoor transmission when social distancing has been maintained is very, very low. Swimming is a little bit of a challenge, but again, with respect to proximity, one end of the pool, the other end of the pool, playing catch in the pool, obviously jumping around, diving close to each other, seeing who can hold their breath longer, those are things that are probably riskier. But I think the risk of swimming can be managed if done appropriately, just like kicking a soccer ball can be managed appropriately if supervised.
Okay. Here's one from Maria. I'm an incoming freshman to college, and I'm on the edge of deciding if I should stay on campus or stay home. I have cystic fibrosis, so if there's any advice you can give from what you know.
Right, so that's a tough one. So it gets to what is the school doing to help you, right? So some schools are saying single dorms only. Some are saying doubles are okay. My son's school, they're not doing triples, they're doing doubles. If I was a person living with CF going off to college, I would be very nervous about a double and would feel better about a single. And then what are going to be the situations with respect to class size and the availability of space to social distance. And the issue of the dining hall is complicated. And so those would be the things that are high on my checklist to explore while you're going through your decision making. And then what we've been doing in our practice is we've been booking time with patients to run through the checklist. And you should do that with your own care team so that you can run the checklist with them, discuss the pros, the cons, the risks, the benefits, and any obvious pitfalls that could be avoided before you make your final decision.
Okay, Lauren, here's one from Dana. Can you please share after the call some of those creative socializing ideas?
Share like right now or?
She said after the call, I don't know, can they go to, do you have them listed somewhere or?
I have some compiled. I'd be happy to email them to you if there's any way that they can be provided after the fact through an email if we have those.
Yeah, we have the emails. So
yeah, and in brief, I can say that some of our families have said that they've kind of socially distanced in their own front yards. One idea that I thought was really cool was we had a family that's very close with their neighbors, and each family has young children around their age, and they did like a street-wide barbecue where everybody grilled out in their front yard, and all the kids could blow bubbles and they could do chalk and they could talk to one another from a very safe distance, and it helped really foster good community on that street where they were playing. Another idea that came up from our clinic actually was something from our physical therapist about Uno boot camp that kids can play and we're doing at home. That was really cool, and that helped keep them very active. A couple other games that came out were through text message that our teenagers really liked. And I don't know that I would even know the name of it exactly. My family actually played it one time while we were all in quarantine, but a picture came out through text message, and everybody got a turn to name one movie through the picture, and someone kept score about who got the most movie titles right. And everybody seemed to have a really good time with that, and was a good way to stay connected and to foster some friendships and some games and staying in touch in a time where it was really hard to.
Okay, great. Lauren, were you able to see these questions by any chance?
I did briefly. I scrolled through them. I can't get a good look at all of them together because I'm on a phone.
Okay. Were there any that maybe stood out to you that you thought should be answered, or?
Not that I stood out. I think as I scrolled through them, I saw a lot of like really common themes that were fantastic questions. I'd encourage you to take back to your individual CF teams to see if they can be answered that way. We've had a lot of really good luck doing some of those more individualized appointments, helping kids going back to college, going to daycare, going to school, and planning that way too.
Okay, great. And then I guess we'll end on this one because I think this is a good question. Should children, this comes from Peggy, should children change out masks during a 6-hour period?
So this is my personal opinion, that there's not a lot of information about this. And again, this gets to the different levels of protection or the different purpose of the mask. When this thing gets a little moist and uncomfortable, I change it. When I work at certain hospitals, I get one of these a day. At other hospitals, they're more freely available, and we can change them as we feel that we need to. N95s, they have to be fitted, and they're really, in some ways, they're really not designed to be worn for hours at a time without taking a break. And so with respect to that, that was kind of my opinion. But if I was going to be in a situation, and I am in a situation throughout the day, I change my face coverings from time to time, depending upon if I'm being clinical, if I'm moving through the building and want to be a little more comfortable. But when this thing gets a little bit soggy, then I change it out. And so I think that that's how personally I deal with it. And I think that, again, is a reasonable strategy and a safe strategy.
Great. All right. So I think we'll end it on that note. I just, again, want to thank the both of you for being with us tonight. I think that was very, really good information that people can take home with them and use it for their situations, to make that informed decision that they need to. I want to thank everybody for joining us this evening on this webinar. I hope you were able to receive the information that will help you. I'd also, again, like to thank Gilead, Mylan, Foundation Care, and Alliance RX Walgreens Prime for sponsoring tonight's webinar. If you want, please go to our website, www.takeabreatherfromcf.org, to learn more about us and our mission. That will conclude tonight's webinar. Again, thank you very much, Dr. Chidekel and Lauren. We appreciate your advice. Everybody have a good night and stay safe. Thank you.
Thank you, Matt. Thanks for
Thank you.
Take
Thank
care.
you for having us.
Yes, absolutely.